TREG Autism Syndrome. TREG Autism Syndrome was first described in 2007 and refers to how the TREG syndrome model of disease can be applied to autism. TREG Autism Syndrome is a synonym for autistic detritus. TREG Autism Syndrome is defined as an abnormal immunogenic response to immunogens or autoimmunogens in a genetically predisposed individual, resulting in structural and functional changes in neurons. Definition of TREG Autism Syndrome or autistic detritus. The definition includes the clinical, genetic, immunological and anatomical models of autism. The definition of TREG Autism Syndrome or autistic detritus is as follows. 1. Clinical hypersensitivity or hyposensitivity to extreme negative and less frequently extreme positive thoughts and feelings. The feel-good feelings are divided into gratitude, acceptance, trust and honesty. The feel-bad feelings are divided into self-pity, resentment, fear and dishonesty. When good feelings predominate, there is greater connection with the external environment and people. When bad feelings predominate, there is reduced connectivity with the external environment and people. 2. Clinical hypersensitivity or hyposensitivity to higher sensory modalities. These include vision, hearing, taste and smell. 3. Clinical hypersensitivity or hyposensitivity to peripheral sensory modalities. These include touch, proprioception, vibration, pain and temperature. 4. Obsessive-compulsive behavior. 5. Reduced memory and learning abilities, although sometimes learning and memory in specific areas is increased. 6. Gross and fine motor and speech delay or hyperactivity. 7. Clinical hypersensitivity or hyposensitivity of the autonomic nervous system. 8. History of associated medical TREG syndromes, for example, the autoimmune diseases and epilepsy. 9. History of associated psychiatric TREG syndromes, for example, attention deficit hyperactivity disorder or ADHD. 10. Family history of associated medical TREG syndromes, for instance, the autoimmune diseases. 11. Family history of associated psychiatric TREG syndromes, for instance, alcohol and drug dependency. 12. Abnormal rate of growth of head circumference within the first 3 years of life. 13. Abnormalities of cell-mediated and humoral immunity in the brain, blood and gastrointestinal tract. Associate Professor DeWitt of East Carolina University is investigating TREG cells in autism. 14. Abnormal genotype. 15. Abnormal biochemical investigations in the brain and blood. 16. Abnormal anatomy including structural and functional changes in various parts of the brain, renal dendrites and dendritic spines. Hopefully, Associate Professor DeWitt's research into the function of TREG cells in autism will lead to new treatments in the future.